Hello, my friend supporter. Welcome to medical science class. As a student of medical science, I wanted to take flavor every branch of medical science. What kind of things I do, that is bad, that is not, that is just, that is good, what that is not. As a Muslim, Allah is the one and only creator, except Allah, Allah, Kishan, last and best messenger. La ilaha illallah Muhammadur Rasulullah wa ila samad khaliq malik la tadul jalali wa ikram. Allahu Akbar, Allahu Akbar, Allahu Akbar, Allahu Akbar, ashhadu an la ilaha illallah, ashhadu an la ilaha illallah, ashhadu anna Muhammadar Rasulullah, ashhadu anna Muhammadar Rasulullah, hayya ala salah, hayya ala salah, hayya ala falah, hayya ala falah, Allahu Akbar, Allahu Akbar. হে আল্লাহ, এই পরিপূর্ণ আহ্বান শাশ্বত নামাজে তুমি হযরত মুহাম্মদ সাল্লাল্লাহু আলাইহি ওয়াসাল্লামকে দান করে বেহেশতের সর্বোচ্চ সম্মানিত স্থান মাকামে মাহমুদ যা প্রতিষ্ঠিত তুমি তা আজকে দিয়েছো, নিশ্চয় তুমি প্রতিষ্ঠিত পেতে। Now my friend was about a medical science class. We describe a bit about without organ like heart, lung, liver, kidney, how can you survive? In case of eye survive, ear also survive. In case of limb survive, but what happened to other thing? In case of gut, already say that without gut how can survive patient. Now GI tract already say organ, what organ remain? Now heart, other organ in case of can survive without tongue, that no problem, can survive and tongue transplant easily. Fine. Now I already said eye transplant. Now we describe a word about in case of organ, brain, already said. Common disease, describe elaborated about. In case of heart disease, common disease, how will you understand you have the heart disease? You have left-sided pain, that region, left pectoral region, where heart occupies, that region is called pectoral region of the heart. What area occupies the heart? Pectoral region of left-sided, chest pain, left-sided, radiate to neck, left-sided neck, tip of the shoulder. That when you do work, any work, you feel breathlessness come. Normally breathlessness not come, that what you do, breathlessness, but you have not suffered the asthma or lung disease, but breathlessness come. That symptom, then you check the pulse and BP, then you understand that you have a heart disease, and go to the doctor do ECG, that is primary test, ECG, electroencephalography. By the doing electroencephalography, you can understand you have heart disease or not. And how much okay, damage. In case of coronary artery circulation of the heart, the problem is coronary artery supply or heart, visceral pericardium, myocardium, endocardium. In case of heart, there is a covering pericardium, parietal pericardium, visceral pericardium. In between there is a fluid. Sometimes heart infection is rare. Sometimes what is the reason of heart infection? Rarely, but rare case also coczovirus or say the book. Am I right or wrong? Coczovirus, maybe. Fine. Heart infection, okay, fine. But infection, that is common. In coronary artery block, that is common, and infection common, infection rare. Bapre. And in case of heart disease, if you identify as a heart disease, now sometimes they take the long time drug heart disease. But what is the problem? If you correct that, then you have no to the heart disease, heart drug disease. How? For example, if you have coronary artery disease, if correct that, how you take heart drug? Why you take the heart disease? If your vital sign remain normal, no need. If your vital sign is not remain normal, then you take the uh, 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 then you take the if your vital sign like pulse and BP not remain normal, then you to take the correct the pulse and BP. There is a drug you continue. But if your vital sign is not come normal, the operation or cure is not correct. Still now right, but not cure the disease. Which doctor give you treatment, not cure your disease, that there is the management. Give the management, not cure the disease. As a doctor, you understand that you manage the disease condition, not cure the disease. Any disease, if not cure properly, you not in come back in normal condition. If you not come in normal condition after suffering that disease, that is not cure. That give the management and just survival range, you can survive. But management protocol maintain. Management protocol maintain, not cure the disease. Just like diabetes, just like heart disease, chronic disease, those are chronic disease. You have the management protocol as a doctor, I salute you, but not cure the disease. In case of cure, what is the cure the disease? How? In case of that disease, heart disease, what is the without heart drug, without take drug, BP, control the BP or pulse, how can we do that? Doctor say you suffer the coronary heart disease, bypass surgery. And maximum bypass surgery, go to the open heart surgery. Bypass surgery, or your artery is blocked, angioplasty. But bypass surgery, there is a process, not open the chest. By that process, you go to the internal carotid artery, and easily to correct that. Also, in case of bypass surgery, you can correct that. How you go to the internal carotid artery to arch of aorta, then arch of aorta to you go to the coronary artery. What is where the block? You just like where is block? You by micrometer suture material take you take the artificial vein, go to this route and take the hole, and there where arch of aorta to suffer. And for management the bleeding, ultrasonograph guided, you see that. Fine. Now it is tough, but easily to. That is the surgery protocol. now it is the modern open heart surgery. That is the modern open heart surgery, not open the chest, go to the internal carotid artery, micro instrument or nano instrument, then do that. That is the modern surgery, not only heart but also any organ. If one or two any organ cut down, 1/3, 2/3, you go to the artery or vein and cut the micro cell, and sucking out the without any organ, chest organ, heart, lung and abdomen organ. There is the microsurgery and nanosurgery, microtechnology and nanotechnology. We say that surgery, modern surgery, still now accessible, but hopefully inshallah as soon as possible come. Thank you very much my friends for today's enough from Medical Science class. I am Beauty visit of Dr. Mohammed Shukri, MSC